To the Point with Kelly Dunn and Michael Williams.
The future of the medical care you receive and how much you pay for it could be changing. The 9 justices of the United States Supreme Court will decide, most likely in June, whether President Obama's historic overhaul of the healthcare system is constitutional. Good morning and welcome to the Point. Kelly Dunn is off today. For 3 days, the Supreme Court heard the arguments, pro and con, from lawyers on the Health Care Act, now 2 years since it's been signed into law. Today, we hear from 2 doctors in our area, the medical perspective from physicians on the front line. One favors the Health Care Act, one opposes it. Joining us, Dr. Brant Delhamer, an emergency room physician. He favors the president's health care law. And Dr. Jack Zeltzer, a vascular surgeon. He opposes them. Both practice in Palm Beach County. Let's begin with you, Dr. Zeltzer. Why do you oppose the Health Care Act?
Well, I just want to be clear that I am not fundamentally opposed to changes in health care because that's sorely needed. We have a system that's entirely broken and is definitely in need of an overhaul. I just think that the current way it's being done is not going to be an adequate solution to our existing health care problems. I think that if the wheels have fallen off the cart, adding another horse to pull it another half a mile down the road isn't going to be a solution.
How is it broken? What are the worst breaks in the system as you see them?
I think the worst break in the system is the absolute disconnect between the physician and patient care. I think there have been too many widgets put in between that as time has gone by that has caused this major obstruction in terms of delivering care in a direct fashion to patients.
The biggest widgets?
There are a lot of them. I just think there are too many, I hate to say the term pigs at the trough, but I think there are too many hands in the cookie jar. I think the insurance companies, legislators, everything that gets between me and my patient is a problem.
We are talking now about a plan that will affect every single American. Doctor, you favor this. You're in an ER. Why do you favor reform?
Reform is badly needed, and Jack brings up an outstanding point. The current system is completely unsustainable, and we all know this. The sustainability of healthcare in the United States is fundamental not only to our country's identity, our country's security, and how we take care of ourselves and how we take care of each other is fundamental to the United States just in its character.
But unlike Dr. Zeltzer, who opposes the Affordable Health Care Act because you think it's too onerous, it's 100 or 2,000 plus pages that get more in the way of doctors and patients. You support it. Fundamentally, why? Why is it better than what we had before?
What we have before, truly what you're asking is, why is it better than what we have now? What we have now completely ignores the uninsured problem that we have in the United States. Completely ignores it. It ignores the millions of patients that we see every single day in the nation's emergency departments that have nowhere else to go, that have no access to care other than the emergency care.
And who pays for their emergency care?
Well, ultimately we all do.
And this is the argument from supporters of the Health Care Act. They say, listen, the individual mandate in 2014 would require all Americans to purchase insurance so that those who have it aren't also paying the bill for those who don't. You agree with that?
I think that the philosophy behind the individual mandate is well intended, and I think that practically speaking, it's an option that I think the administration was right to pursue.
Dr. Zeltzer, you don't agree with that. Why? Because here's the argument. You just heard it. You know this full well. Why should people who are paying for their own insurance be paying even more for all of the uninsured? If we get more people in the pool, so the argument goes, and more healthy young people, then the cost will be spread out across a larger base, making it cheaper. You don't agree?
It's not that I don't agree, I just think the method that we're going about it is fundamentally wrong. I think we've gotten onto the wrong path and we keep pursuing this wrong path in terms of how health care should be delivered. Fundamentally, you have to ask yourself whether health care or the access to health care really is a right, a thing that everybody should be entitled to, and if you decide that's the case, that's one road you're going to take. If you feel it's not a right, it's a commodity, like purchasing cable TV, everybody can have access to it, but you need to have the dollars to get it, then it's a commodity.
Right or commodity in your view?
I come from Canada where socialized medicine was in place the day I walked in with my doctor's degree. And so maybe I'm a little biased that way, but I believe that, number one, it's a right, but number two, it is something that everybody should have access to health care, but it doesn't mean that everybody therefore needs to purchase a plan. Whether you do it the way socialized medicine does it, and as scary as that term sounds, I believe there are many things that are of some advantage to that.
Such as?
Everybody has access to health care. It's right there. And you're not paying it. And the concept that your health care is tied to your work, to your job, is to me, again, coming from Canada, just off the wall, basically. I don't know what else to say about it. You lose your job, you lose your health care. It doesn't make sense to me.
Dr. Delhamer, we'll see what the vote will be. Many argue the swing vote. Justice Kennedy seemed in arguments to perhaps favor the argument that you cannot compel Americans to buy health insurance. Let's assume for the moment that the decision comes down in June and essentially the Health Care Act is essentially gutted. What then? You heard what the doctor said. How do we fix it? How do we get to more of a free market model that makes sure more people have access to it, that broadens out the base to make it less expensive? Can we get there, and if so, how?
I'm not sure if we actually can, because if you leave the impetus in the hands of the individual patients, and you bring up the younger patients, the healthy patients, the ones that are supposed to mitigate the costs and spread them out for insurance companies taking care of patients that have more expensive needs. That's been left in their hands, and it hasn't worked. And we see patients every single day on a daily basis, young, healthy patients that have made a conscientious decision to not purchase health care that still need it. And these are patients that otherwise were previously healthy, the ones that we're trying to bring into the system with the ACA.
So you think the only mechanism to do that is to basically be compelled to do so? Through an individual mandate or some other mechanism?
They've been given the choice. Healthcare is different. Healthcare is not necessarily a commodity the way Jack agrees with. Healthcare is different. By stating that as a practitioner, you think that healthcare is a right, you're saying that everyone has the ability to have access to it. And right now, what we have limits that. It limits it. The commoditization of healthcare, I think, is fictitious.
Let's say both of you were sitting in the room. We started from scratch. What are the fundamental things you would say would begin to rebuild the system? Let's assume, again, for argument's sake, that the Health Care Act's overturned. We don't know what's going to happen in June, but let's just assume that for a moment. If that happens and you were brought into the room, you're both going to help build it from scratch. What are the fundamental things you would say are absolute bedrock provisions we need?
Preventative care. You have to have preventative care. The United States, as an industrialized nation, has really failed, and by any legitimate measure, failed in preventative care.
But how do you get to more preventative care, especially if you can't create a free market mechanism to get more people to buy insurance to help pay for it?
You make access easier. You make it better.
How do you do that, though?
By making it more reasonable in cost.
Doctor?
Well, again, you have to figure out who the payer should be. I would say if you're starting with a blank slate, which is where we should have started, and that's my opposition to this issue, is that we need to align incentives. Now, in this...
In plain English, what do you mean? For the people watching who say, listen, everybody agrees healthcare is too expensive.
Not everybody's in healthcare for the same game.
Okay.
People are
but boil it down. What do you mean in terms of incentives?
I mean, we have to agree on one fundamental principle. What are we trying to get out of this system? And in my mind, what we want to get out of this system is a healthy population, like Brent says. And so preventative care is a huge building block because, in point of fact, my income now comes, and his income now comes, from people having people unhealthy. We're paid on a per act basis. So if you are fundamentally unhealthy, I do more acts.
We have heard,
it's backwards.
And are you saying, Dr. Zeltzer, that what we need fundamentally is a model that pays doctors and pays more attention to preventive care than paying them for the sick patient who comes in?
You have to incentivize everybody. Number one, focus on the patient, because that's really what this is all about.
How would you incentivize me, the patient? Just give me an example.
I would try and give you some perk, whether if this system was done on a governmental level and this was coming out of tax dollars, I would maybe offer you certain deductions if it's a healthcare premium you're paying or whether it's coming out of your taxes.
My cholesterol is good, my blood pressure is good, maybe I get a break.
You get a break. And so you'd be motivated.
And you as a doctor, and we don't have nearly enough preventative care doctors in this country, I see you shaking your head, you provide more incentives for them to go to that model, correct?
Absolutely.
But a free market incentive, do you think that can work? I still see a disconnect here that you're shaking your head, Dr. Elhamer, that you don't think we necessarily can get there that way.
In as much as a free market incentive, the way that Jack describes it, I'm not sure if that's really reasonable to expect without, I mean, a significant paradigm shift in how people view their care. We view care in the United States, we view healthcare as episodic and disease-based. That needs to change, and that cannot just come from Jack and myself, talking to our blue in the face and telling people you need to be more focused on prevention.
The other aspect of this whole challenge is that we spend a lot of money on healthcare. It just doesn't get to where it needs to go, and there is a real problem with that. And I think that when we start ranking way below third world countries in infant care, in obstetrical care, there's something wrong, because it isn't that we're not putting the money out, we're not getting value for our dollar.
More than any other industrialized country, and indeed many opponents say we don't need to add a 10-year price tag that's now ballooning, perhaps $1.6 trillion. Exactly. And you fundamentally are saying we don't need more government intervention to get there. You're saying you're not sure we can get there without at least a modicum of government intervention, i.e. something that might represent an individual mandate. So you're still in the room, you still have that fundamental difference. You both agree we need more preventive care, more frontline doctors, need to find a way to get people to get in there before they get sick. You're still writing the plan. In our last few minutes, how do you get us there if you're the one sitting there with Congress, insurers, the White House, and writing the plan, and they say blank slate?
I wish I could solve it in 3 minutes.
Which we can't. But they haven't solved it in decades, so exactly. I don't expect that'll happen.
But I think we can, and I am certainly not in disagreement with Brent about, we're in fact in concert. It's just that that the system itself can't go on, and we need to change certain things.
Fundamentally, and boy, did I get feedback on this when I posted on the Facebook, but one of the questions is about, can you get rid of the individual mandate, requiring people that they must buy insurance? Very controversial. And what about provisions that most Americans seem to like? Pre-existing care coverage, keeping your children on your policy till they're 26. Would you build from the ground up with at least some provisions like that if you had the chance?
Yes.
And what would you keep?
Absolutely, but give me a blank slate. Let's write all the things that we really need: preventative care, keeping kids healthy, to get rid of pre-existing conditions, and then figure out how you're going to fund.
But market incentives, not government top-down.
Whether it's market incentives or not government top-down, because I don't think that has worked.
Lasting quickly.
A fundamental problem with the system that we have in place right now, and I think that it would continue on if you actually left this to the market, is the market has spoken. And we have patients, and we have a population that has decided not to invest in healthcare when they don't need it, to the tune of millions of patients. And I think that a mandate is ultimately going to be required if you really want to bring the cost down.
Dr. Delhamer and Dr. Zeltzer, thank you so much for joining us, at least trying to frame some of the issues on this topic of importance, no matter what your view, to all of us. Thank you both for being with us today. And coming up next, our roundtable looks at the Florida political scene, and we'll ask our roundtable experts their thoughts on how all of this plays out on the healthcare issue in the months and years to come. Back in a moment. One Floridian plays a key part in the case before the Supreme Court on healthcare. We'll talk about her when we come back.
It spans nearly 2,000 square miles. Most call it the Treasure Coast. I call it home. And whether it's breaking news in Fort Pierce or severe weather in St. Lucie West, the safety of families here is our top priority. With news bureaus in Stewart and Port St. Lucie, always keeping you informed, safe, and out of harm's way. That's what we mean when we say local coverage you can count on. That's WPTV News Channel 5.
For 48 years, my family business has served the needs of our customers and provided not just a better night's sleep, but an easy buying experience and a great value. Now we've assembled the latest collection of the finest mattresses available, offering them at 10 to 20% below market sale prices.
During the City Mattress Spring Clearance, enjoy extra clearance savings on select mattresses, adjustable beds, and bedroom furniture for every comfort and budget.
Come in today. You'll wonder why you waited so long. City Mattress, real savings every day.
A wound that won't heal is more than unsightly. It can threaten your health. That's where we can help. Using non-invasive hyperbaric oxygen therapy, or HBO, we have a proven record of healing wounds that other treatments couldn't. So don't give up hope. Give us a call. Healing wounds is what we do.
Bethesda Memorial Wound Care and Hyperbaric Program. Call 561-737-7733.
Hey guys, breakfast!
If whole grain isn't the first ingredient in your breakfast cereal, what is? Now, in every box of General Mills Big G cereal, there's more whole grain than any other ingredient. That's why it's listed first on the side. From Honey Nut Cheerios to Cinnamon Toast Crunch to Lucky Charms. Get more whole grain than any other ingredient without question. Just look for the white check.
The U.S. Supreme Court has its justices and, to the point, its commentators. News Channel 5 political analyst and coordinator of the American Studies program at Lynn University, Dr. Robert Watson. I don't see either one of you with your robes, but Brian Crowley, author of the Crowley Political Report, one of the state's veteran political analysts. Gentlemen, healthcare. Pam Bondi, the Attorney General in Florida. Florida, of course, spearheading the challenge to the healthcare law and the individual mandate. We've talked about it. If that's thrown out by the Supreme Court and a decision expected in June, it could take the legs out completely. Talk about her role, talk about the wider view about health care. Brian, we'll begin with you.
Well, I think we forget that Bill McCollum actually got
started
this thing.
That. That's true. It was Bill McCollum during the campaign.
Pam Bondi, Chief Justice Crowley's having trouble speaking today. Pam Bondi picked it up and ran with it and enthusiastically. And I think, win or lose, she's going to start looking like an emerging star, I think, in the Republican Party, certainly in Florida. Maybe not the next time, but I think you'll start hearing people talking about her being a potential governor of the state. You know, this is within the Republican Party and within the conservative circles that care deeply about this issue. I think she's going to be a rising star.
Robert, we have seldom seen in recent years, in fact, in memory, a topic that's so much as a hot button about this individual mandate. Does government have a right to say you must buy, in this case, a commodity, health insurance? Talk about the wider view here, where this is going, both from the nation's health, literally, and, of course, the political component of this year.
Well, this is a huge case from an historical perspective, a huge case constitutionally, and on top of all of that, it's a political blockbuster because it occurs during a presidential election cycle. We've been down this road before in the terms of 1935 with Social Security. In 1937, Social Security had to go before the High Court. Arguments about excessive federal power, expanding the federal role in the Constitution, the government's relationship to the citizens. In 1965, with Medicare, we had court challenges that went all the way to the Supreme Court. Similar arguments. More recently, in 2006, under Republican President George W. Bush, with the Medicare prescription drug changes, that went before the High Court. The High Court supported that, and it was essentially the same court with the exception of the Obama appointments. So there's some serious constitutional issues here we're looking at. On the one hand, the reserve clause, sort of the 10th Amendment. Anything that's not anything that's not designated to the federal government, it goes to the states and to the people. On the other hand, the Commerce Clause. It allows the government to regulate interstate commerce. And of course, some justices said, though, are you creating commerce in order to regulate it with the individual mandate? Both sides have a legitimate ground to stand on legally. And ultimately, this is going to have a tremendous impact, one would imagine, either way, on shaping the politics of this year. Every American and every politician agrees we've got to do something about health care, but how we do it and the mechanisms we use have been so contentious and are going to have an impact in 2012. It's hard to imagine how they couldn't.
Well, especially if the Supreme Court ultimately tosses this out in June, I think the question Democrats will come back with to the Republicans will be, now what? Because the crisis in health care that we have in this country doesn't disappear with the decision that tosses us out. We just go back to square one. So then it will be important for the Republicans to forcefully come back with their alternative plan, and they have some plans out there that they think are better.
Interstate competition on insurance markets. Some of them said they're not necessarily against pre-existing condition coverage, things like that we're talking about.
And those are the kinds of things that they're going to have to quickly come back with a plan. I think they can't just rest on the notion that they won in the Supreme Court and they can move on to November. And they'll certainly try to beat Obama with that defeat.
To carry on that very briefly, as a political but also an economic issue, whatever side you're on for this country.
Well, I agree with Brian. I think that if this is thrown out, I think this is going to put health care as an issue almost equal to the economy, jobs, gas prices in the fall, if it's thrown out. I'm going to go against conventional wisdom. I think whichever side loses will have the wind in their sails. I think if this is thrown out, this could energize the Democratic base. It could bring Democrats out to say, my goodness, how far are the Republicans willing to go? This Supreme Court decision smacks of the Bush versus Gore 2000. Or likewise, if it passes, I think Republicans are going to come out of the woodwork to get behind some kind of legislative challenge to it.
Let's go straight politics here. Marco Rubio and former President George H.W. Bush and Florida's junior U.S. Senator throw their support this week behind Mitt Romney. Talk about that.
Joining Jeb Bush, who
endorsed
Romney a couple of weeks ago.
Jeb Jr.
You know, I'm one of these guys who think it's much ado about nothing. And on CrowleyPoliticalReport.com last week, I wrote that it's a nice plug for the blog there, folks.
I see Rubio supporters and Bush supporters saying, what do you mean?
Well, you know, I think it was, you know, I wrote that it was basically sort of, I didn't use the word cowardly, but that's what comes to mind right now. I mean, who cares that where were they in January before the Florida primary, or any primary since then? So they've joined a chorus of Republican establishment folks out there who want to wrap up the nomination.
I agree,
Robert,
Brian.
final thought.
These endorsements are typically much to do about nothing. The bigger question about endorsements is, why did he skip a Bush generation? Why did he get Bush 1? Nobody wants to touch Bush 2. He's still radioactive. But yeah, I don't think this is going to move the dial one way or the other, although it does look like the fat lady's backstage warming up. This thing's over. Romney's got it. We're off the hook. We called this months
stunned, I tell you, stunned that we haven't brought up Rubio as a possible VP.
We want to invite Marco Rubio to come here to announce whether or not he's going to run for vice president. You know.
Our justices are setting that up this summer.
I have my academic robe I could have brought from my office.
All the tassels, too. We'll be back in just a moment. Time now for the Watson Wrap and the Crowley Closer. Robert?
Speaking of the campaign ending, stick a fork in Newt Gingrich. He's had to lay off his staff. His fundraising is dried up. He'll probably barely make it to the end of April. At the end of April, you have 5 northeastern states, some of the most expensive media markets. How's he going to afford to run in those media markets?
And I think it would be appropriate to note the death of West Palm Beach City Commissioner Bill Moss. Whether you agreed or disagreed with him on the issues, he was very, very active in his community, all the way back when he started the Southside Civic Association group down there, and you know, the city will mourn the passing of Bill Moss.
A proper and thoughtful note upon which to close this broadcast. Gentlemen, as always, thanks for your perspective. We appreciate it. We'll work on those justices' rope. And we thank you, as always, for taking time to join us on To The Point. We wish you and yours a wonderful week. Good day, everyone.